coming up. They make up our beautiful smiles. But if our teeth could talk, what would they say about our health?
You may get the front 6 teeth all straight and pretty, but if you don't get the back teeth lined up properly, they can cause damage to the joint.
Dr. Ellen Sprinkle reveals how our well-being is rooted in the way we bite.
It's amazing to me how you can hook up your computer and see what's going on with the mouth.
The conversation starts now. Real friends, loving, laughing, and learning together. Sharing stories, one life at a time. So grab a seat. Welcome to Joni Table Talk.
Teeth, we use them to eat with, but did you know that your pearly whites can tell you a lot about your health too? Well, today with the help of our special guest, we'll look at what your mouth might be saying about your well-being. But first, joining me around the table is April Simons. Are you ready to talk about teeth?
I'm ready. Ready.
We talk about everything around the table, don't we? Yeah.
It's great.
Cindy Murdoch and her great smile. How are you?
Thank you. I'm good. And you know, you just made me think of something, and that's why I think people say flossing is important for the heart. So I guess our teeth really do.
We'll ask about that.
Yeah.
Rebecca Lamb, are you ready to learn?
I'm always ready to learn.
You have great teeth, by the way.
And I'm thankful for my teeth. Yeah. I have a good dentist.
Yes, you do. You do. Dorothy Newton, how are you?
I'm doing great.
Are you ready to learn about your pearly whites?
Yes.
Okay. And my dentist, everyone, Dr. Alan Sprinkle, welcome to the table.
Thank you very much.
So good to have you. Well, a graduate of Baylor and founding member of the Academy of Clinical Sleep Disorder Dentistry, Dr. Sprinkle has helped countless individuals with their oral care and overall wellness. And today he's here to give us some tips and cutting-edge information to help us live healthier. So tell us, what is it that you feel like you can share with us to help us as it relates to teeth and our health?
There's a huge percentage of the population that has chronic headaches, and 85% of those headaches are caused by muscular disorders that are created by your teeth improperly coming together. When your teeth hit improperly, your bite is off, it can affect your temporomandibular joint.
Wow.
But people say, I've got TMJ. Well, yeah, you got 2 TMJs. There's one here and one here. It's kind of like saying, I got knee. So if you have this pain or your dentist says you have TMJ, what you're talking about is your TMJ may not be functioning properly because of the way your teeth come together.
Amazing. Explain to us, can you kind of hold that up there and show us, Dr. Sprinkle, what you're talking about?
This part of the model is called a condyle, and the condyle is the ball in the socket. And this is the most unique joint in the head because you've got 2. They can't work independently of each other, okay? They have to work together for you to chew.
Right.
I mean, we as dentists, I think, sometimes forget, and as patients too, that our teeth are here to function as chewing mechanisms. They're not just to have pearly whites and smile, which is nice, but they got to be able to chew and function for your health. They're there for your speech too.
And they're organs. A lot of people don't realize they're living, breathing organs.
They're not bones.
They're not bones.
They were bones.
Exactly. They're exactly.
Becca thought they were bones.
Me and Mom had a competition over this, and we had to Google it. I was like, they're bones. I was like, they're organs. She was right. She was right.
They're harder than bones. The enamel is the hardest structure in the human body.
Wow.
But this jaw functions like a door, so to speak, okay? And your jaw joints are the hinges. And if, you build a new house, say, and the house settles over time, and now all of a sudden your door doesn't close quite right. It takes more energy to get it to close than to get it to open because it's rubbing, there's friction there. And the same thing can happen to your jaw, and that excess friction can damage the joints even further, but it can also create a muscle response that results in chronic head and neck and facial pains and headaches. And so what we're gonna see right now is this is a normal joint. This is a cadaver dissection. And what you see right here that looks like a piece of bow tie pasta is a normal, healthy disc. This is kind of like a rubber washer. It's a shock absorber. This is the head of your jawbone or the condyle that we were looking at a second ago.
That's healthy.
Okay, that's healthy.
Yeah.
This disc is healthy. And look how much space there is between the head of the condyle and the base of your skull. Your ear is sitting right here. So when you close, this thing gets really close to a little canal called a petrotympanic fissure that goes up into your middle ear. So if you get infection or inflammation in here, it can cause your ear to feel like you've got water in it or it's stopped up, it's stuffy, okay? Now this is a joint that's diseased in the fact that it has what's called a medially displaced disc, meaning the shock absorber, that rubber washer, has fallen off to the inside, okay? And now it's popping back on in place and then off. Now look how little space is between the head of the condyle and the base of the skull.
So when
It's
your
like
when your
bare
jaw
space.
pops, is that what?
That's what's happening. This disc is popping off and on, okay?
Wow.
Oh wow.
All right, now that's not good. This one, the disc is displaced to the front or anteriorly, okay? Here's the disc down in here. You see it here.
Yeah.
Now they're opening now, pops on.
Gross.
Is that painful for someone?
Some people it is, some it's just annoying.
It looks painful.
And then they open and pop on. And
Like a
now it's
rubber band.
functioning normally here, but it's pop off, and there can be problems. But you'd still have some retrodiscal tissue back here, but again, this space, and you can see this on an x-ray. Now the worst part is if it gets to this, and this is called degenerative joint disease, and this is on the left side, this is the left jaw, but there's no tissue here, there's no disc, that's the disc. The disc has been completely destroyed, pretty much, okay? So this is arthritis, you can see this bone on bone, there's no retrodiscal tissue, and this is can be very painful, or it may not be painful.
Wow.
So how does that happen to someone, the deterioration of those joints?
It can happen through trauma. You know, as a little kid, you might fall off your bicycle and hit your chin. Well, the growth center to your jaw is in the condyle. Think about a boxer. He gets knocked out. What happens? He gets hit in the chin, and that crams up right by the ear. And all those nerves and the neurology that I was talking about causes you to black out, okay? But if you hurt this growth center here, then it's not gonna it's gonna either get diseased and start to deteriorate. I have a 14-year-old patient right now whose left condyle is arthritic and it's not growing, it's shrinking. And so as she grows, when she smiles, a normal smile, you're gonna have a straight line parallel with your eyes. Hers is like this, because her jaw, as this shortens,
Oh, wow.
the lower jaw, the mandible, goes like this.
Right.
The only thing that she's going to be able to do, unfortunately, is probably have surgery a little later on in life to try to repair that.
Yeah.
So with football, does a mouthpiece protect all those hits and everything?
To some degree, if they can keep it in its proper place, it's going to help keep that from jamming
Her son
back up
plays
into
football,
the
so
joint.
she's
Yeah.
worried about it right now.
Yeah, exactly. When I was in the 8th grade, I got hit in the chin playing football, and my jaw got locked open. Fortunately, I had a football coach who knew what to do. He got me up against the wall, pushed my jaw down, bam, and back up, and got it back into place. But it's always been damaged.
Oh, wow.
I don't have pain with it, but
Yeah.
it does pop and click.
So let's talk a little bit about what causes headaches, like you were mentioning, and what people can do to help this procedure that you're doing now, and how all this interconnects.
Well, called a T-scan. And this is a technology that's able to measure the forces and timing between your teeth. There's always been a controversy in dentistry for many, many years about, does your bite, or occlusion as dentists call it, affect your jaw joints and cause TMJ? I'm going to get in trouble with any orthodontist that'll watch this, because orthodontists never, nothing cause that a problem at all. And there's a lot of general dentists, myself included, say, yeah, it does. And if you may get the front 6 teeth all straight and pretty, but if you don't get the back teeth lined up properly, they hit oddly and they can cause damage to the joint. I had a lady come in Wednesday of last week. She was an emergency. Terrible headache, terrible pain. She couldn't even touch the skin on the back of her head. It hurt so bad. You think, well, your jaw wouldn't hurt that. That wouldn't make any difference. She couldn't raise her arms and she couldn't squeeze. She thought she was coming down with MS. We did the T-scan, which I'll show you here in a minute, which is a sensor that measures pressure and the amount of time that pressure is exerted on your teeth. It measures it within 3/1000ths of a second. She had 2 teeth on the left side. The back 2 teeth on the left side were hitting totally abnormally because of their position in her mouth. I went in and adjusted the bite on those teeth. Took me 20 minutes. Within 20 minutes, she could raise her arm, she could grip her cup, and her headache was gone.
Wow. And do people's teeth normally hit on one side more than the other, just naturally?
Ideally, you would like the pressures and the timing to be, bam, everything hits at the same time, and it's balanced right to left and front to back. The real issue, though, is not that, it's the way we chew and the way our teeth come together as we chew. And it's the friction of the way especially your back teeth, because your back teeth are different. The sensory organ in your back teeth, or what are called mechanoreceptors that feel pressure and strain, are in the little ligament that connects your tooth to the bone. And it's that little nerve in those ligaments that lets you know, oh, I got a strawberry seed caught right here.
Yeah.
Okay, because those teeth, your teeth don't connect directly to bone. There's a little gap there, and there's these little bungee cords that hold your tooth in there. And so when you get that strawberry seed in there, your teeth go like that. And this is getting stretched, this is getting stretched, getting compressed over here. And all that message goes to your brain. I got a strawberry seed right here.
Yeah.
Okay?
Wow.
But you put too much pressure on those ligaments, what's called the periodontal ligament, or the PDL. If I touch your skin here, you feel that because it goes up your arm, up your shoulder, right before it gets to your spine, it synapses or joins another nerve, which then takes it to your brain. The PDL on your posterior teeth, your back teeth, you put too much pressure on it, it goes straight to your brain. It doesn't synapse. It goes straight to your brain, goes to what's called the trigeminal motor nucleus, which then sends a reflex back to the muscles of mastication and causes them to clench even more.
Do you have some slides to show us on this?
Okay,
This would be neat to see.
This is what happens. Traditional dentists just use articulating paper, which is
Where you bite down
the
on
carbon
that paper.
paper.
I've
yeah.
seen
Right.
that.
After
like
you
the-
get a feeling or
Yeah,
something, they'll
they'll
have
go
you bite
tap,
down.
tap, tap, tap,
Right,
tap.
right.
Okay?
I've done
and
that.
so you look in here and you see these spots. And so that's where the ink is. Well, we were taught in dental school, the bigger the spot, the bigger the pressure. It ain't so, because with the T-scan, you can see exactly where the pressure is. And a lot of times, it's the little spot. It's like me stepping on your foot with combat boots and me stepping on your foot with 8-inch spike heels. It's not a very pretty picture of me in 8-inch spike heels, but it's the little spot where the pressure per square inch, so to speak, is so intense. And at dental school, we were taught totally backwards with what the science is now showing us. Okay?
And DTR stands for?
Disclusion time reduction. That means how long does it take you to get your back teeth apart if you slide right to left, which is kind of the chewing motion backwards, because we can't have you chew on this piece of film. So we have you go back, we have you clench and then say slide to the right. And if all your back teeth start rubbing together, what happens is you get all this friction built up here. And so what we try to do is we go in and we'll make little tiny adjustments in the surface of those teeth, or sometimes we'll go in and we'll add just like a little tooth-colored filling on the back side of your eye tooth. Your eye tooth or your canine or the fang, that is the longest and strongest rooted tooth in your head. It's the cornerstone of your mouth. And so when you chew in an ideal bite, not everybody has an ideal bite, but they're kind of the guide planes that help your jaw come in a proper angle. But if you don't have that guidance, say your teeth are a little short, or you have what's called an anterior open bite, where you've got when you close your teeth together, you've got a little space you could stick your tongue through. You don't have coupling of those teeth, then all your disclusion is on your back teeth. And that's what was happening with the lady I was telling you about. It was all, basically hers was all on her back teeth, but the majority of it was on these two teeth. She's getting married, she's planning what, so she got a little bit of stress.
Right.
And that added up to put her in this state of excruciating pain.
Yeah.
And that's what happens.
So what are some of the symptoms again?
You clench or grind your teeth, you wake up with facial pain. And you're working those muscles out, just like you were at the gym. Or you're tired when you chew and eat, or you just get to the point, I can't even chew gum, it hurts so bad. Chronic jaw tension, popping or clicking. For years, I made hundreds, if not thousands, of splints, night guards for people that clenched and ground their teeth. But I didn't solve a problem. I just, what it did was it separated those back teeth. But as soon as the patient takes it out and chews and eats, or even just talking sometimes, it'll create that tension in the muscles, that friction. That door can't close smoothly enough, and it creates this reflex where you start clenching more and the muscles get tired and it creates this pain. Peter Dawson, who's a very famous dentist, said when muscle and teeth go to war, muscle always win. And you can see people who have ground their teeth down to the gum line.
Wow.
And it's from this clenching, this drive that they cannot control because of this reflex from the trigeminal motor nucleus that causes these muscles to grind all the time.
Wow. Well, let's meet one of Dr. Sprinkle's patients who was hopelessly living with pain thanks to TMJ and tinnitus until this groundbreaking treatment changed his life. Take a look.
I had a very intense stress job. The stress was there from life, and things that I've gone through previously all worked itself into a powder keg situation. All of a sudden, my ears, it was pretty much consistently ringing. It is the loudest sounds you'll ever hear. I feel like there's knives just chiseling into your jaw and your neck, and someone's just slapping your face with a sledgehammer. Utter agony that I can't encapsulate with the human dictionary. So I went doctor to doctor, specialist, North Dallas, South Dallas, East, West. I mean, I went to them all. And I'm 30 years old, just turned 30, and I get told by a doctor, you have high-pitched frequency tinnitus, there's no cure, it's just your life. It's not a big deal. Just the worst news you can ever hear. And I said, Jesus, I don't know what to do. This is not my life. Things started to look better when I got recommended to go to a chiropractor from a Christian nurse, and the chiropractor immediately said, you need to go to Dr. Sprinkle. He was able to examine me, and within a matter of minutes, could tell me everything that was going on. He said, if it's TMJ related, then all we need to do is fix the TMJ, the ringing will go away. And I'll tell you what, I'll never forget when I heard the sounds of feet, and I could hear the rain, I could hear birds, but I'll never forget hearing my mom and my dad's voice, because I forgot what they sounded like. I've spent tens of thousands of dollars on doctors who didn't do anything, surgeries that I didn't even need. But since I've been working with Dr. Sprinkle, that pain and the intensity has been diminishing every single time. The good days get better. The bad days are nothing like they used to be. Thank God for Dr. Sprinkle, because your outlook is of hope and faith. You go through life, you win, you lose. You keep Jesus Christ as your center in your faith, you're gonna win, I guarantee it.
All right, that was really interesting story there, and this treatment was able to actually alleviate his pain. That's so amazing.
Well, that, and it also helped with his tinnitus, the ringing in his ears. I mean, it hasn't completely gone away. He does have periods of time when it's totally gone, but most of the time he still has a little bit of background sound. But my assistant Dina walked into the operatory and his face lit up. And he goes, oh my gosh, I can hear footsteps. I can hear her walk in there. The ringing was so loud, he felt like he was going deaf.
What is the other condition where your
Vertigo.
inner ear?
Vertigo.
Vertigo.
Yeah.
Have you helped people with that as well?
Yes, yeah. Wow. Because again, you saw how close this joint is to the ear. I had a young boy come from Oklahoma to see me, and he was diagnosed with what's called tensor tympani syndrome. And tensor tympani is a little muscle in the palate that affects the middle ear. And he had an infection in his throat that we worked with some homeopathics that helped with that. But the key trigger was his bite. And once we got his bite taken care of,
That's
he's
amazing.
pretty much taken care of.
Well, don't go anywhere. We're going to be right back with more from Dr. Sprinkle, and our own Dorothy and Rebecca are going to get the test. Stay right there. Well, we've heard all about this revolutionary procedure for diagnosis and treatment, and now Rebecca is in the doctor's chair to give you a first-hand look at just how this technology works. Okay, Dr. Sprinkle, you've got my youngest.
Oh, boy.
This is called a T-scan. It's made by a company called TechScan out of Boston. And then what's unique about this is Dr. Kirstein, the gentleman that developed this technique, he got TechScan to work with BioResearch, the company that makes this technology, which is an EMG that measures muscle activity, to create a linking software to where we can see in real time the changes in muscle activity as a patient bites and moves their jaw right to left.
Okay.
So what we're gonna do right now in Rebecca, we're gonna do what's called a right lateral excursion. Okay, so she's gonna go, I'm gonna place this in her mouth, and this little sensor is gonna pick up the pressure between her teeth. Don't close yet. Close, squeeze real firm, slide to the right, open. And what this is doing is it's picking up the pressure between her teeth every 3/1000ths of a second. And it's showing us, before she closes, her muscles are at rest. There's very little electrical activity in here. And then as she starts to close, the muscles start to fire. And here she is in clenched mode. She's clenching, and now she's gonna start to move her jaw to the right. To move your jaw to the right, you have to fire this muscle in your temple. And to do that, though, to get your jaw to move, you gotta have the one on the left side shut down. So you see this one's firing, and the left side shuts down. The right cheek muscle, master muscle, fires just a little bit, and the left cheek muscle's firing just a little bit. So she has good movement. She's got, once the movement starts, everything shuts down. She does have some interferences, but she doesn't have hyper muscle activity. Rebecca says she does have headaches every now and then. You can see here that she's got quite a bit of pressure right here on the right side. But as I move this little gray bar you see here, this is the movie. I can move it in slow motion. So now she's gonna start moving to the right. And you see that by the path of this little kite and the tail that it leaves. So she's sliding straight over here to all these back teeth on the right side. And here she hits maximum pressure with here, because that's the height of this. And then she kind of lets off and she bounces back to the left because she's caught up on this left back side. So the force is now, the center of force is now traveling back to the left. That creates instability in her joints. It also can create hyperactivity in her muscles and create a headache if she starts to clench and grind or gets under stress. So now she's trying to get back to the right, and she never makes it.
So what will you do to help even that out? Because it should be 50-50 on each side.
Right.
Instead,
Ideally,
what was she? She was like 45-55.
well, when she closes, she's got really good balance. She's 54% on the left side and about 46% on the right side. The problem is the kite is below this line. So that lets us know that she has too much pressure in the back. And ideally, you'd like to lessen this, and especially right here, because this could be damaging to that tooth. You just go in there and just barely take a little bit of tooth structure or filling structure off, or it could be a crown, just take a little porcelain off to where that's not quite so heavy.
That's amazing. So I know you've had a lot more cases. Let's meet another one of Dr. Sprinkle's patients. This young woman was dealing with extreme facial muscle fatigue before undergoing this procedure. Take a look.
I've been having facial pains, the jaw, up in the temples, since I was young, 4 or 5 years old. So I didn't smile. My mouth was always closed. I talk really lightly. I don't want to open my mouth. And as you know, that leads to all kinds of problems with people thinking you're mean all the time because you don't want to open your mouth. So we've had that problem since 4 or 5.
We finished our first session of DTR and did a little physical therapy on you. How you feeling?
Actually, I feel good. I came in and I was in total pain. I was just feeling bad about having my mouth open for so long. But right now, I have no pain in the back of my head.
What was your pain like in the back of your head when you came in?
It was throbbing and hot in the back of my head, right in the center in the back. My jaws were hurting. My jaws are not hurting right now. And my neck is not hurting right now. So notice the smile on my face. I feel a little bit better right now. So I am a total believer.
Awesome.
It's amazing to me how you can hook up your computer and hook up all this paraphernalia and see what's going on with the mouth.
Well, you can measure it, and when you can measure it, it's reproducible, and that matters. You can't measure just a carbon paper bite. You know?
Right.
You can see where the pressure is, but you don't know when it occurs, and you don't know where the highest pressure is. And you can't see inside the mouth as the patient chews or taps their teeth or slides to the right or slides to the left. There are multiple surfaces in there that are interacting, and you're standing out here and you're going to try and see past their tongue. You can't do it, but you can see this with the T-scan, and you can see how the muscles interact.
Yeah.
And Rebecca's muscles are fine. She does have some areas that she has a little hyper or excess pressure on. It'd be very simple to just, you know, basically as a prophylaxis to go in and smooth those out, so it hopefully help her from ever having a problem with headaches or TMJ.
Yeah.
Things like that.
She's ready to go.
I'm ready to
You know,
go.
she's got this beautiful smile and beautiful teeth, but you don't know what's going on with somebody's bite, do you?
Right.
So,
Yeah, and like the lady that we just saw, I mean, she never had headaches. She just hurt and burned. She had this burning sensation and this fatigue in her face. It hurt to talk, it hurt to smile, and for her, most of her life growing up, people thought she was mean. She's a wonderful lady. She's a psychologist. I mean, it was
That's
a
awesome.
real pleasure to
Wow.
help her.
That's great.
And can I add something?
Yes, yes.
And if you want to learn about or possibly find someone in your area that does this technology, you can go to info@CNO, that's Center for Neural Occlusion, TMJ, CNO, TMJ.com, and you can find someone in your area that's certified. Right now, that number of dentists that are doing this is not a large number, but hopefully with this and other videos that are on YouTube, you can find someone in your area that's certified to do this.
Okay. Well, again, you can visit him online at hareliefalternatives.com. And to find a disclusion time reduction therapy provider in your area, again, you can email info@cnotmj.com. There's a need in your life. If you'd like for us to pray for you today, we have incredible prayer partners standing by, ready to do so. Also, we'd love for you to join the conversation online by leaving us a comment on Facebook, or you can tweet me at Daystar Joni. Thank you so much for watching. I hope you enjoyed this today. I hope it can be a blessing to someone. We'll see you next time. Bye-bye for today.
This has been a Daystar Television production.